My American friend Jake visited me in Australia last month. On day three, his U.S. health insurance company called him. And no, he hadn't even submitted a claim yet. He hadn't sent them paperwork. He hadn't asked for a dime. They called him because they were worried. Not about his health, about their money. That phone call unraveled everything Jake thought he knew about healthcare. And honestly, it broke something in both of us. Let me set the scene. It's Jake's third day in Sydney. We're at Bondi Beach, the iconic one with the turquoise water that looks photoshopped but isn't. Jake's feeling himself. He's been watching the locals body surf and he decides, I can do that. How hard can it be? I should mention, Jake is from Chicago. The closest he's gotten to ocean waves is Lake Michigan on a windy day. So he paddles out, waits for a wave, and when it comes, it comes fast. He tries to catch it. But the wave has other plans. It picks him up, flips him sideways, and slams him into the sand like he owes it money. I hear this sound. It's not quite a scream, not quite a grunt. It's the sound of a man realizing he's made a terrible mistake. I run over, Jake's sitting there, soaking wet, and his left arm is just wrong. It's pointing in a direction arms should not point. His shoulder is fully dislocated. Now, here's where it gets darkly comedic. Any normal person's first thought would be, get help, call emergency services. Jake's first words? Do not call an ambulance. I'm like, mate, your arm looks like a broken action figure. He's sweating, half from pain, half from panic, and he says, dude, I'm serious. Last time I took an ambulance in California, it cost me $2,800 out of pocket. My insurance covered $300 of it. $300. I'm standing there, an Australian, trying to process this. I say, but you're injured. You need medical help. He looks at me with this wild expression and says, just call an Uber. I'll hold my arm. We'll make it work. So now I'm in this surreal situation where I'm trying to convince a man in excruciating pain that it's okay to get emergency medical transport. I'm literally negotiating with someone about whether their physical well-being is worth potential financial ruin. We compromise. I call an Uber. Jake spends the entire 7-minute ride Googling how to relocate your own shoulder and Sydney hospital costs American tourist. The Uber driver keeps looking in the rearview mirror like, should I be worried? And I'm just, mate, you have no idea. We get to the emergency department at Prince of Wales Hospital. It's busy but organized. There's a triage nurse at the front desk. Jake approaches like he's entering enemy territory. He's clutching his shoulder, face pale, and the first thing he says isn't, help or I'm in pain. It's, do you need my insurance card? What forms do I need? Can I get an itemized estimate before treatment? The nurse, her name tag says Sharon, just looks at him with this expression of deep concern. Not medical concern, emotional concern, like she's encountered a traumatized animal. She says very gently, love, just sit down, we'll get you sorted. Don't worry about payment right now. Jake physically cannot compute this. He says, but I need to know if this is covered. I need to call my insurance company for pre-authorization. Sharon interrupts him. Darling, you're injured. Let us help you first. We'll figure out the rest later. She takes his basic information, name, date of birth, that's it, and directs us to the waiting area. No photocopy of his driver's license, no credit card on file, no signature on liability waivers, no, if you can't pay, here are your financing options pamphlet. Jake is vibrating with anxiety. He keeps whispering to me, this feels wrong. When does the bill come? When? 20 minutes later, they call him in. A doctor examines him, orders x-rays to make sure there's no fracture. The radiologist is friendly, makes small talk about Chicago while positioning Jake's arm. The doctor comes back with the images, confirms it's a clean dislocation, gives Jake some strong pain medication and a muscle relaxant, and then, with a practiced motion, relocates his shoulder. Jake yelps. The doctor pats him on the back and says, good as gold, mate. You'll be sore for a week, but no permanent damage. They give him a sling, a prescription for pain medication, and a physical therapy guide. They tell him to follow up with his GP in the States in 2 weeks. The entire experience, from check-in to discharge, 90 minutes. Jake keeps asking different staff members, when do I pay? Do I settle the bill now? Every single person tells him, reception will sort you out on your way out. We get to the billing desk. Jake is bracing himself. He's done the mental math. In Chicago, an ER visit for a dislocated shoulder ran him $4,200 after insurance. That was with a $1,500 deductible already met. The billing clerk, a woman in her 50s with kind eyes, types into her computer for maybe 15 seconds. She looks up and says cheerfully, "All right, for a non-resident presentation. That'll be $550 Australian, please." Silence. Jake just stares. Then he says, "550 to verify my insurance information?" She looks confused. "No, love, that's the total. Emergency department fee, x-rays, doctor's consultation, medications, everything." Jake pulls out his phone with his good hand, opens the currency converter. 550 Australian dollars equals 360 US dollars. He looks at the screen, then at me, then back at the screen, then at the clerk. He says very slowly, "That's less than my copay. That's less than my ER copay in Chicago. I paid $175 just to walk through the door last time, and my insurance covered 70%. The clerk smiles, not understanding the existential crisis happening in front of her. "Will you be paying by card?" Jake pays. We walk out. He's silent the entire way to the car. Finally, he says, "I just got full emergency care, x-rays, pain medication, a doctor relocating my shoulder, discharge instructions, for less than what I spend on my monthly insurance premium." I'm like, "How much is your premium?" $680 a month. That's $8,160 a year. Jake is 32 years old. He's had health insurance since he was 22. That's 10 years. He's paid roughly $81,600 in premiums alone. Not counting deductibles, not counting copays, not counting the bills insurance didn't cover. And in that decade, he's been to the emergency room twice. The first time for a severe allergic reaction, $4,000 out of pocket after insurance. The second time, before this trip, for a suspected concussion, $3,200 after insurance. He did the math in the parking lot. He'd paid over $81,000 to an insurance company and still ended up paying nearly $7,200 out of pocket for 2 emergency visits. In Australia, as a non-resident paying full price with zero coverage, he paid $360. That's when something broke in Jake's face. The next morning, Jake wakes up to a voicemail. It's from his insurance company. Now remember, he hasn't called them. He hasn't submitted a claim. He just paid out of pocket and moved on. But his insurance company has a system that flags international charges on the credit card linked to his premium autopay. The voicemail says, "Hi Jake, this is Madison from Blue Cross Blue Shield Care Management. We noticed a healthcare-related charge in Australia. Please call us back to open a case file so we can verify this was a qualified emergency expense." Jake calls back, puts it on speaker so I can hear. "Rep, Madison. Thanks for calling back, Jake. So we're seeing a charge at a hospital in Sydney. Can you tell me what happened?" Jake: "Yeah, I dislocated my shoulder body surfing. Went to the ER, got it relocated." Madison: "Okay, and did you contact our international emergency helpline before seeking treatment?" Jake: "No, I was injured. My arm was backwards. I just went to the hospital." Madison: typing sounds: "I see. Well, since you didn't utilize one of our in-network international partner facilities, we're going to need comprehensive documentation. That includes the itemized bill translated into English by a certified translator, the ICD-10 diagnosis codes cross-referenced with U.S. standards, and a letter of medical necessity from the attending physician on official letterhead." Jake: I just paid it. It was $360. Madison, long pause: "I'm sorry. Can you repeat that?" Jake: "The total bill was $360 US dollars. I paid it out of pocket. I wasn't planning on filing a claim, but you called me." Madison, another pause: $360 for emergency department treatment? Jake: "Yeah, x-rays, pain meds, the doctor popping my shoulder back in, discharge instructions, everything." Madison: "And this was at an accredited hospital, not a—" She pauses, clearly choosing her words carefully. "Not a walk-in clinic or alternative medicine facility?" Jake: It was a major public hospital. It was Prince of Wales Hospital. It's one of the biggest in Sydney. They had an entire orthopedic department. Madison, genuinely confused. Sir, I'm looking at our internal cost projections, and the average ER visit with imaging in the US is $2,400. For international claims, we usually see anywhere from $3,000 to $8,000 because of out-of-network rates. Are you absolutely certain you received comprehensive care? Jake is staring at the phone like it personally insulted his mother. Jake, are you asking me if the hospital was real? Madison, no. I just... Our system flags claims under $500 for potential fraud because they're statistically abnormal. Jake, the care is abnormally cheap. That's the point. There's this moment of silence where you can feel Madison's worldview cracking. Madison, okay, well, even if you're not seeking reimbursement, I still need to close the case file. Have you met your deductible for the year? Jake, no, my deductible is $5,300. Madison, right, so even if you submitted this, we wouldn't reimburse you because you haven't met your deductible threshold, but we still need the documentation for our records. Jake, so you want me to spend time and money getting documents translated for a claim you won't pay? For a bill that costs less than my monthly premium? Madison, it's just protocol, sir. Jake hangs up. He looks at me. My insurance company literally cannot process the idea that healthcare can be affordable. Okay, let's zoom out, because this isn't just Jake's story. This is America's story. Here are the numbers for 2025 and 2026, and I want you to really hear them. In America, the average family health insurance premium is now $27,000 per year. That's $2,250 every month. The average individual deductible is $5,304. That means before your insurance pays for anything, you're paying over $5,000 out of your own pocket. If you're on an ACA marketplace plan, premiums are projected to jump 26% in 2026 if the RPA subsidies expire. That's an extra $200 to $300 per month for millions of Americans. An emergency room visit, just to walk in, can cost anywhere from $1,000 to $3,000. If you need imaging, procedures, or medications, you're looking at $4,000 to $8,000 on average. An ambulance ride? $1,200 to $3,000, and it's often not covered by the No Surprises Act because ambulances are contracted separately. The average American spends $12,555 per person per year on healthcare. That's total spending, premiums, deductibles, copays, out-of-pocket costs, everything. In Australia, for citizens and permanent residents, Medicare covers most essential healthcare at zero upfront cost. You walk into a bulk billing GP clinic, you pay nothing. You go to a public hospital emergency department, you pay nothing. For non-residents, like Jake, an emergency department visit costs $500 to $1,000 Australian dollars, which is roughly $300 to $650 US dollars. An ambulance ride in most states is either covered by a tiny annual levy, like $50 a year, or by state funding. In Queensland, it's completely free for everyone, residents and tourists. Australians spend an average of $6,240 per person per year on healthcare. That's half of what Americans spend. Now here's the kicker, the Commonwealth Fund, one of the most respected health policy research organizations in the world, ranked 10 developed nations on healthcare system performance in 2024. Australia ranked number 1 for equity in healthcare outcomes. The United States ranked dead last, 10th out of 10. We're not just spending more, we're spending double and getting worse results. Americans have lower life expectancy, higher infant mortality, worse maternal health outcomes, and higher rates of preventable deaths than Australia, the UK, Canada, Germany, France, the Netherlands, Sweden, Switzerland, and New Zealand. Let me say that again. The richest country in human history has the worst healthcare outcomes in the developed world. Jake isn't an outlier. He's the average American. He pays $8,160 a year in premiums. He has a $5,300 deductible. That means he's spending $13,460 before his insurance meaningfully kicks in. And when he finally does need care, his insurance company interrogates him about whether the hospital was real because the bill was too low. This is the system. This is what we've normalized. Jake spent the rest of his trip in a weird fog. Not from the pain meds, from the realization. We went to a cafe in Newtown the next day. He ordered a flat white. The barista noticed his sling and said, "Aw, mate, what happened?" Jake told her the story. She winced and said, "Oh no, that's rough. You feeling all right? Did they give you good pain meds?" Just casual human empathy from a stranger. Jake teared up. Right there, over coffee. I was like, "You good?" He said, "I've lived in America my entire life. I've been conditioned to see medical care as this adversarial transaction. You go in, they do the bare minimum, they bill you into oblivion, and your insurance company fights you every step of the way. Nobody ever just asks if you're okay." He told me about the last time he went to the ER in Chicago. He'd hit his head during a pickup basketball game, felt dizzy, and went to the hospital to make sure he didn't have a concussion. The doctor spent maybe 8 minutes with him, ordered a CT scan, told him he was fine, sent him home. 2 weeks later, he got a bill for $3,200. His insurance company paid $1,100. He was on the hook for the rest. He called to dispute it. The insurance rep told him the CT scan wasn't medically necessary because he didn't lose consciousness. Jake said, "So I'm supposed to wait until I'm unconscious to get imaging? What if I have a brain bleed?" The rep said, "Sir, that's between you and your doctor." Jake paid the bill in installments over 6 months. He didn't go back to the doctor for his follow-up because he couldn't afford another copay. This is the reality for millions of Americans. People skip doctor's appointments because they can't afford the copay. They ration insulin because it costs $300 to $400 a month without insurance. They pull their own teeth because dental care isn't covered. They Uber to the hospital instead of calling an ambulance because the ambulance costs more than their rent. Jake looked at me over his coffee and said, "I thought this was just how life was. I thought everyone lived like this. I didn't know it could be different." And that's the most heartbreaking part. Americans have been gaslit into thinking this is normal. That it's normal to spend half your paycheck on insurance and still go bankrupt from medical bills. That it's normal to avoid healthcare because you're afraid of the cost. That it's normal for insurance companies to deny claims for life-saving treatments because of medical necessity clauses. Jake grew up thinking Australia's healthcare system was socialist and inefficient. He'd been told by politicians and media that universal healthcare meant long wait times and rationing. I said, "Mate, how long did you wait in the ER?" 90 minutes, total. "And how long did you wait for your concussion scan in Chicago?" He paused. 4 hours, and then 2 weeks for the follow-up I never went to. The propaganda doesn't match reality. When Jake got back to the US, he decided to do an experiment. He had the hospital receipt from Sydney. It was itemized in English, showed the date, the services rendered, the cost. Very straightforward. He thought, maybe my insurance will reimburse me since I've paid so much into the system. He submitted a claim through his insurer's online portal, uploaded the receipt, wrote a detailed explanation. 2 weeks later, he got a response. Claim denied. Reason? Deductible not met. He called them, spoke to a different rep. "Rep? Yes, sir, I see the claim here. Unfortunately, since you haven't met your $5,300 deductible for the year, we can't reimburse you." Jake, "But I'm not asking you to cover the full amount. I'm just asking if you can reimburse anything. I paid $8,000 in premiums this year." Rep, "Premiums and deductibles are separate, sir. Until you meet your deductible, all covered expenses are your responsibility." Jake, "So the $360 I paid in Australia counts toward my deductible?" Rep, "Actually, no, since it was an out-of-network international provider, and you didn't get pre-authorization." Jake, "You can't require pre-auth for emergencies? That's illegal under the No Surprises Act." Rep, "That act applies to domestic surprise billing, sir. International claims fall under different guidelines. Since the provider wasn't in our network and the claim is under our threshold, it won't count toward your deductible." Let that sink in. Jake paid $360 out of pocket. His insurance company won't count it toward his deductible, and they won't reimburse him. So, functionally, it's like the care never happened in their eyes. But here's the twist. If Jake had been in the US and had the same injury, the bill would have been $4,000 to $6,000. Insurance would have paid zero because of his deductible. So he would have paid more, gotten the same care, probably worse based on his experiences, and still been on the hook entirely. His insurance company would rather he'd paid thousands in America so they could avoid paying anything while still counting it toward his deductible than accept a $360 bill from Australia. The system is designed to extract maximum money while providing minimum care. Jake did the math. If he needs surgery in the next year, let's say something moderate like a knee arthroscopy, the cost in the US would be surgery, $15,000 to $25,000. His deductible, $5,300. His coinsurance, 20%, $2,000 to $4,000. Total out of pocket, $7,000 to $9,000. The same surgery in Australia for a non-resident paying full private hospital rates. $5,000 to $8,000 Australian dollars, which is $3,000. $200 to $5,200 US dollars. Jake said, Aka, I could literally fly to Australia, have surgery, recover for 2 weeks, fly back, and still pay less than I would in America. And the care would probably be better. He's not joking. He's genuinely considering it. Medical tourism from the US is a booming industry. Americans fly to Mexico, Thailand, Costa Rica, and yes, Australia for procedures, because even with the plane ticket and hotel, it's cheaper than staying home. That's not a healthcare system. That's a scam. Here's what Americans need to understand. This isn't about politics. This isn't about left versus right. This is about math and human dignity. Every single developed nation on Earth has figured out universal healthcare except the United States. Australia has it. Canada has it. The UK has it. Germany, France, Japan, South Korea, New Zealand, everyone has it. And yes, those systems have problems. Wait times for non-urgent care can be long. There are gaps in coverage. It's not perfect. But you know what they don't have? Medical bankruptcy, the #1 cause of bankruptcy in America. People rationing insulin GoFundMe campaigns to pay for chemotherapy. Parents choosing which kid gets to go to the doctor this month. People dying because they couldn't afford an EpiPen. In Australia, if you have a heart attack, you call an ambulance. It comes. You go to the hospital. You get surgery if you need it. You recover. You go home. Total cost, $0. In America, if you have a heart attack, you wonder if you should call an ambulance or have someone drive you. Worry about whether the hospital is in-network. Worry about whether the ambulance is in-network. They're often separate. Get treated. Receive a bill for $30,000 to $150,000. Fight with your insurance company for months. Maybe file for bankruptcy. This is insane. Jake told me something that stuck with me. He said, I spent my whole life being told I live in the greatest country in the world. And then I dislocated my shoulder in Australia and realized I've been lied to my entire life. America isn't the greatest country in the world by most measurable metrics. We're 38th in life expectancy, 33rd in infant mortality, 46th in maternal mortality. We have the highest incarceration rate, the highest healthcare costs, the most medical debt, and some of the worst wealth inequality in the developed world. But we've been conditioned to think that universal healthcare is impossible or too expensive. Meanwhile, Australia does it with a population of 26 million. Canada does it with 39 million. The UK does it with 67 million. The math works, the proof exists. The only reason America doesn't have it is because the healthcare industry, insurance companies, pharmaceutical companies, hospital conglomerates, makes hundreds of billions of dollars off the current system. In 2023, the top health insurance companies made United Health Group, $22 billion in profit. Cigna, $6.7 billion. Elevance, formerly Anthem, $6 billion. They don't want you to have affordable health care. They want you scared, confused, and dependent. Jake is coming back to Australia next year. He's already booked the ticket. He told me, if I'm going to get hurt, I'd rather do it somewhere that won't ruin my life financially. Think about that sentence. An American would rather be injured in a foreign country than deal with his own healthcare system. That's not patriotism. That's survival. If you're American and this story made you angry, good. You should be angry. You deserve better. Your kids deserve better. Your parents deserve better. Healthcare is not a luxury. It's not a commodity. It's a human right. And the fact that this story sounds unbelievable is exactly the problem. The fact that a $360 ER bill is shocking tells you everything you need to know about how broken the system is. I'm not saying Australia is perfect. I'm not saying our system doesn't have flaws. But Jake shouldn't have to choose between his health and his financial stability. Nobody should. So here's what you can do. 1. Share this story, talk about it, normalize these conversations. The healthcare industry wants you to think you're alone in this struggle. You're not. 2. Vote for politicians who support universal healthcare, not better insurance marketplace options, not expanded subsidies. Universal, healthcare, Medicare for all, single payer, whatever term you want to use, demand it. 3. If you have a story like Jake's, tell it. The more people speak up, the harder it is for politicians to ignore. And 4, take care of yourself. If you're rationing medication, if you're avoiding the doctor, if you're in pain, please find resources. Community health centers, sliding scale clinics, patient assistance programs. Don't let the system kill you. Jake sent me a message last week. He said, I thought American exceptionalism meant we were the best. Turns out it just means we're the exception, the only developed country that treats healthcare like a business instead of a right. He's not wrong. America can do better. We have to do better. Because the current system isn't just failing, it's killing people. And somewhere right now there's another Jake, another person sitting in an ER not thinking about their health but about the bill. That's not freedom. That's cruelty. We deserve better. And it's time we demand it.